After 9 years of work to introduce a national health insurance system in the Virgin Islands, concerns are still being raised about the viability of the plan and even the validity of the recommendations made by the University of the West Indies research team. During government's on-the-road program held at the King Garden Bay Community Center on Monday, March 25th, residents expressed concerns about the viability of the proposed health insurance system.
Instead of making it mandatory for all the citizens of the BVI, the persons who have insurance, if they opt to keep their insurance, they can do that. The persons who don't have insurance, then it should be mandatory on those persons.
Has the government given it any concern what's going to happen to all home insurance so high already? Because, tell you the truth, the insurance companies are planning. I believe they are planning that when you pull this from under them, they're going to pork up themselves in another area.
I think it is a good idea once it's executed properly, and I think that's the fear of most people, because the health service that we have right now, we can't say it's top-notch.
As far as I am concerned, this national health insurance is no benefit to me because my children are in the U.S., they were born there, and how I would be able to provide coverage for them while they're in college.
The system is going to look after all legal residents in the country. There'll be people who are not working, people who can't work, there are people, children, and the government will have to continue to put large sums of monies, up to $39–40 million into the scheme in order for a good healthcare system to develop in this country. But the way it is going now, cannot, and I say cannot be sustained.
The minister disagreed with a suggestion that local insurance companies are likely to lose business with the coming on stream of the national health insurance. Small businesses can transfer their existing health insurance services under the proposed health insurance plan. Health Minister Ronnie Skelton said employers should offer employees at least basic health insurance.
The same 50% that you're paying for your employees, you can pay that into the national health insurance. And if you want to give your employees in the office, you give them a 3.5% raise to pay to the national health insurance, and you pay the other 3.75%. So I really don't see a problem, but the defined level of benefit, in my mind, is what we as a people need to start concentrating on to make sure that we're being properly covered.
In 2005, the government of the Virgin Islands asked the University of the West Indies Health Economic Unit to conduct a study on the economic feasibility of a national health insurance system for the territory. In August 2009, Cabinet accepted the proposal for the completion of the design and implementation of the national health insurance system. Minister Skelton said similar systems in several other countries were examined to inform the design of a system for the BVI, such as the National Insurance Services in St. Vincent.
This study was tested against other social security systems, like in Denmark, the one in St. Vincent, and a couple more other they was tested against. So basically, you're not doing something from basically scratch. You're learning from other people. And some of the best systems are in Europe. Denmark has one. The Scandinavian country, Taiwan, they are very good systems out there. But it's a national health insurance system. And the whole basis of it is to protect the health of all the people.
Government is looking at ways to fund the system during the early stages of the implementation period, and according to the minister, the national health insurance is not intended to bring any undue burden on residents.
The national health insurance system is supposed to cover all legal residents in the country, and there are provisions for all other exceptions, like children at school and so forth and so on. The whole idea of the national health insurance is not to bring undue burden on its people. we're a small percentage of the BVI population. And we have to find means and ways of how we can build our health system, that it can deliver the kind of care that you need here in the Virgin Islands, so that when you find yourself at the clinic, this clinic here at the hospital, that the system is being built, it's being developed to give you that level of comfort, that level of care. And that's the whole thing about the National Health Insurance.
The National Health Insurance System is aimed at providing lifetime health insurance coverage and improving access to healthcare services for all legal residents. The main features of the plan are mandatory membership for all legal residents, access to a comprehensive benefit package, medical care, hospital services, pharmaceutical and diagnostic services, with the normal provisions for exclusions, limits, and pre-authorization for off-island services. Access to a network of service providers that include health professionals and facilities in the local public and private sectors, as well as select overseas providers. The National Health Insurance System will be managed by the Territory Social Security Board, a statutory body which since 1981 has been administering Social Security benefits to the population.